bringing a lot of awareness about PCOS. And we have with us Dr. Shravya. And Dr. Shravya, don't you feel that over the past few years, gradually the number of cases of PCOS is increasing?
Yes, Chaitra, I totally agree with you. There are a lot of cases of PCOS in all these young girls.
We also want to kind of know, doctor, about the common cosmetological manifestations that these PCOS girls can have. What are the ones that you see in your OPD?
The commonest manifestations, the cosmetic manifestations would be like acne, the hair fall, hirsutism, that is like excess hair on the face and the body, acanthosis nigrans, which is that thick velvety patch on the nape of the neck, axilla, even on the face. You even get darkening of the skin, the oily skin tags, weight gain, lot more.
I think the list is quite long. But the commonest, if I have to ask, what are the commonest of these lengthy lists that you have given the girl can present with?
Most commonest would be acne, hair loss, acanthosis nigrans, hirsutism.
So these are the top 4. And Dr. Now, a lot of them say that the acne which is caused by PCOS is very stubborn. Can you give me a little more insight on this and how to manage this?
Yeah, it is quite stubborn, but definitely when it is a PCOS case, you have to do a hormonal imbalance for sure. That is the first and foremost step. Then when it comes to the cosmetic side, we have grades of acne, like from 0 to 4. So what happens is, if it's a mild acne, you can use topical face washes and topical creams, and that would do. And all these salicylic acid, benzoyl peroxide is more than enough. But when it comes to a stubborn acne, along with the topical creams, we even have to use oral medications like retinoids. At times, we even have to do chemical peels and lasers as well.
So along with the hormonal correction, definitely a cosmetologist has to be involved to correct the problem that they are facing. Doctor, the other thing that the college girls usually ask is too much of pigmentation underarm. I can't wear the clothes that I want to. Can you give me a little more on what is this and how exactly will you manage this?
That's nothing but acanthosis nigrans. It is just not the darkening of the skin, but also the thickness of the skin. It looks very velvety and thick on the skin, especially on the nape of the neck, behind the neck, axilla, even in the groin areas. At times, I even saw a few people having it on the cheeks, like all over the face. Yeah, you have to even maintain by lifestyle modifications, correct your hormonal imbalance. Along with it, we can use topical supplements. We can even use topical creams, lightening agents for it to come down. At times, we can even go for laser therapies.
So the options are multiple. The last question, doctor, that I have is for this hair fall. Most of them, again, they'll be like, my hair was so thick and now I absolutely have no volume. It doesn't look that good like before. So hair loss because of PCOS, how do we manage this?
Hair loss is one of the most commonest I get. Generally, combined oral contraceptive pills is like one of the best treatment, both for hair loss and even for the excessive hair growth on the body and the face, which is called hirsutism. For this, as I mentioned, we'll give you oral contraceptive pills along with it anti-androgens. It's a topical medication and we have it oral as well. We even give a minoxidil solution for the scalp, a good shampoo, and they can even come down for procedures like PRP, GFC. It's not only going to improve your quality of your hair, but also the texture, improve the hair growth. It helps in all possible ways.
So, like Dr. Shravya already mentioned, it has to be a combined effort from an obstetrician and the dermatologist. And there are ways out. It's not that there is no solution and you have to sit and weep about it. There is a way out. There's a perfect therapy that we can formulate for you. So, any more queries, if you want to meet Dr. Shravya with any of your cosmetological problems, you can do so at CANS Hospital in Vidyaranam.